Welcome to Learn to Live Stress-Free. This is Christine Wright with Dr. Robert Wright Jr., your go-to wellness coaches of StressFreeNow.info. Our featured guest today is Roberta Mittman, a personal revolution coach and professional acupuncturist. Roberta is a dedicated alternative healthcare practitioner, health and wellness coach, speaker, author, licensed acupuncturist, and certified nutritional consultant. She is the founder of the Park Avenue Center for Well-Being. Roberta serves the New York City area as well as those from around the world who connect with her for guidance to attain healthy, happy, and luxuriously empowered lives. Roberta specializes in guiding women through a quiet revolution to look and feel trim, vital, elegant, and unstoppable. Her magic, the perfect holistic blend of timeless Eastern principles and cutting-edge Western information. A self-proclaimed chocolate enthusiast, yay! She's also the author of Ultimate Wellness, the 3 mental shifts you can use to change the course of your health right now. Roberta, welcome. Bob and I are so happy to have you on the show today.
Oh, thank you so much, both of you. I'm really thrilled. And very grateful for the opportunity to spread the word a little bit. And I love your series. I'm just a big fan myself.
Thank you. Excellent.
Wonderful, Roberta. Welcome and greetings. Audience, you are in for a treat. We have Roberta Mittman, who is an amazing person who is located in New York City. And the thing that will be interesting for our listeners here is that Roberta is the first professional acupuncturist that we have had on our show. And so, of course, she's more than just an acupuncturist, but I believe she will be able to address some issues people may have about understanding what acupuncture is and Chinese medicine and other holistic approaches to wellness. So, Roberta, to start us off, can you please share with our audience the significance of why you have a company model talking about life after 40 redefined? And I understand that you have had some life-defining moment yourself where you were challenged to practice what you preach, and that is the kind of thing that our listeners want to know, so they can the relatability that you have walked that talk.
Sure. Yes, I really have this interesting story that I enjoy telling, but with a little intrepidation. So I feel like it's really important to be transparent in this world, and also to help people, understand like how, some of my vision for others, and also which had to start with myself. So basically, I was in practice for many years, and probably 10 or 15 at least, and I had my own wellness center at that point, which is, something that I had always aspired to do. And what happened was I got this call from Boston, and it turned out that my sister, who I'm very close to personally and in age as well, was in the hospital, and she was having major kidney problems. So that came as a surprise because that wasn't anything she ever had before. I mean, that was kind of out of the blue. So they said, you better come down right away because she's kind of in bad shape, and, it'd really be great if you were there. So I zoomed down there. Luckily, it's not that far from New York. And I saw her, and I walked in, and here she is, all hooked up to these tubes and these machines. I mean, when you're talking about kidneys, you're talking about filtering your blood, you're talking about removing toxins, all kinds of things. So anyway, I looked at her and I said, oh, that's a kidney transplant. And the doctors are saying, no, she's going to be fine. She's going to be fine. So I'm thinking about this a little bit, but, just kind of anticipating it. Sure enough, she wasn't able to get better. And what she had was something that the doctor said, we'd read about this in the books, but we actually never met anybody that had this. So it was one of these things that is just kind of fluky, and it just comes on all of a sudden and gives you end-stage kidney disease.
Wow.
So she got to the point where it was like, okay, she needed a transplant. So we're very close. And honestly, I have to tell you, I didn't really hesitate for a minute. And I know she wouldn't have done that either. And so what happened was we made all the arrangements, and she was able to, hang on with the way she was for a while. And they do very, very extremely carefully precise testing to make sure that you are qualified, A, to be a good DNA match, and that also that you are in good enough health, because as being a donor, sometimes it's a little harder for the donor than it is for the actual recipient. So I went through all these testing, and so I got this call, and they said, well, we have interesting news for you. You are a perfect DNA match. That's a go. But you have not passed all of your physical tests, your blood tests and everything, and your actual health is probably a little less than optimal. So that was a surprise for me.
Well, that had to be mind-blowing. That had to be mind-blowing,
yeah.
Roberta.
That was mind-blowing. It was like a glass of, water thrown in my face, And I'm thinking to myself, wait a minute, this is, really scary. A, I'm a healthcare provider because, I kind of should know better or whatever. But B, it really was a wake-up call because I was, saying, what, I can't, participate in this life-saving event because of my health. So I resolved to kind of make this really major turnaround. And I kind of constructed this little, and I'm putting this in quotation marks, little boot camp for myself. And I only had a short period of time to whip myself into shape. And I really did it. I was overworking. I was skipping meals. I wasn't really sleeping. I was overstressed. There's just a lot of things that were going on, and I think I just took my eye off the ball because I was very concerned about everybody else. So I had to change it, set better boundaries, take really good care of myself. And so, P.S., I was actually able to do that, and the operation went very, very well. I am totally fine. My sister's been fine ever since then, so there's a really happy ending. The best ending, however, is that program that I actually put myself on serves as a foundation and core for my health programs for other people, for clients and for patients, because I had an actual, kind of a moment where, this is really counts and you have to actually get good results. And, I was able to see really what worked and what didn't work. And that really sort of set me up for major changes in my advice to other people. So I would say that that's how I started to walk the walk, and it's a very extreme, probably, way that a lot of people have to wake up, but I did, and we're all fine, and my patients are doing, exceedingly well, too.
Wow, Roberta. I almost don't know what to say. That's a really touching story. I mean, the fact that as you said, you were already a health care professional, but
totally.
it sounded to me as if when you used the term that it was a wake-up call, that you were doing what many of us have done and are doing, which is burning the candle at both ends and the middle. I noticed that you said that taking care of everyone except yourself, and although everyone knows this trite phrase about the airline metaphor of put on your own oxygen mask first before assisting others, that is actually harder said than done, because especially when you're a caring person and a nurturing person, and as we see, the world seems to have speeded up. There are so many needs and so many things to get done. So I want to really thank you from the heart for sharing like that. I knew you had an opening story, but wow, that is really some story, Roberta. And I'm glad to hear, as you said, is a happy ending.
Thank you very much. It's like, and I said at the beginning, it is a little transparent because it's probably, it's kind of a little embarrassing, to be perfectly honest, to have to report that. But it really had such great results. And, so I think that, my situation, although this is a very dramatic, I would say a dramatic story, I would also say that many of us are in that same little hamster wheel, that same rut. Whether or not you're a healthcare professional or just somebody at work or just somebody trying to get through their day or a mom or a caregiver, what happens is, and especially women, I have to say, because we're kind of trained to be caregivers and nurturers, that seems to be the fate of many of us. And so I look for that really quickly because a lot of people deflect healthcare because they feel like they're being selfish or self-indulgent.
I see. Just to make you feel better, Roberta, a couple of years ago, because I've been working in the area of stress burnout, I came across some research where I believe the stats were something in the range of 65 to 75% of all emergency room doctors are burned out. Okay, and depending, of course, what kind of scale you use, but you can imagine, in a high trauma situation, and then to me, from what I can see, the nurses or even and nurse practitioners who have even higher levels of stress. In fact, I remember seeing a couple of studies that talked about the high percentage rate of nurses that were smokers, and so they'd have patients come in and say you should stop smoking, and then to keep their stress down, they were smoking. So thank you. So no need to feel embarrassed at all because what you're talking about is a level of honesty and authenticity, and I know our listeners appreciate that. So, Roberta, let me just ask you this question. On your website, you're listed as a personal revolution coach. That's the first time I've ever heard that term. Could you explain and define that term for our audience?
Oh, sure. Well, my website is really geared, and I'm actually going to be changing it a little bit. My website was written a couple of years ago, and it's geared to people who would like to contact me through phone or Skype and, have health coaching, and especially for women over 40. And so I coined that phrase, and actually I'm kind of changing it a little bit, and I'll tell you what I'm thinking of changing it to. But the reason why I came up with that is because just like from our previous discussion, it's like, wait a minute, you're not taking care of yourself, and that is not going to work anymore. You count, you matter, and it's time to start to take a look at your life and see, where you are now, certainly where you've been. I know, where you feel that you want to go, but to also start taking care of yourself. And let's face it, sometimes it needs a little bit of a quiet revolution in terms of your thinking, in terms of eating, in terms of exercise, in terms of relationships, in terms of a lot of different factors, and of course stress. But it's really it's time now to take a change and to really start to take good care of yourself and do the things that really matter. They can be small things. They can be bigger things. I mean, I have programs that are designed to talk about that. But for women over 40, it's a whole new uncharted world. 40, I thought of 40 when I was growing up, and I thought that was so old. And now I'm telling you, people are going to be my mom is 97 right now, and she's amazing. People are living longer. We have so much more time. It's uncharted territory. So what are we going to do with the next 40, 50, 60 years? There's quite a bit more time ahead of us, and people aren't really thinking about it in terms of like a whole other half of your life. And that's why I really want to get people's attention to really pay attention to that. And what do you want? You know, are you done with like taking care of everybody else? Is it time for you to start thinking of yourself? And the most important message, which I have walked the walk about, is that it's never too late. It's just a number, and it's never too late. Everyone has an excuse about why they have to put it off or why they can't really live their dreams. I mean, let's face it. I'm 5'1". I'm never going to be 6 feet in this lifetime or have long, thin legs and, you know, whatever. I mean, that's just not going to happen. But, you know, in terms of living my best, most full life, I'm working on it. And that's what I mean.
That sounds smart. That sounds like the thing to do. Now, Roberta, you're also a licensed acupuncturist. How did you get into that field?
Well, thank you for asking that, because this is like one of my favorite stories, because my father was an MD acupuncturist over 50 years ago. I mean, he was a trailblazer. He was a regular. Look, I'm going to date myself right now, but he was like a little Marcus Wilby type of a doctor. He had a full general practice in the suburbs of New York. He would make the house calls with a little black bag. But he also had this amazing alternative streak, holistic streak. He said there's got to be something else rather than write all these prescriptions and blah, blah, blah. So he fell in love with acupuncture. He fell in love with hypnotherapy. He was doing tapping, which is the EFT, emotional freedom technique, even before it was called EFT. It was called something else. And people thought he was a little nutty, but he got such amazing results. So I like to say that it's in my DNA because he was really quite a pioneer.
It sounds like it was your DNA, so you're continuing the family tradition. Now, what does acupuncture feel like? I mean, is this something that hurts, or how often do you need to do this?
Oh, great question. If it's okay with you, may I just kind of circle back to the last question for 2 seconds? Because It's really something important. What I wanted to mention was that his vision of combining the best of East and West, and you didn't need to choose, really became, I would say, the core principle of my practice today. Because before, and even sometimes now, you know, it wasn't even accepted, but you can really, if you have a combination of the both, I think then that is like the best of all options. So that's what I just wanted to mention. In terms of acupuncture, what does it feel like? Well, it depends on who's doing the acupuncture. You know, Asians, many times they come from China or not, but many times they have centuries of traditions behind them. And it's kind of been in their family or in their village or somebody they know. Anyway, the Asian tradition, Chinese acupuncture, tends to be a little bit more, I want to say a little stronger than Western-style acupuncture. And I'm trained in the States, and I do the Western style of acupuncture because my clients really, and my patients, I should say, you know, I really feel it doesn't have to hurt in order for it to work. And I really do believe that. So it's you feel a little prick when this tiny, teeny, flexible, bendable little piece of filament goes in, and then it should subside. And honestly, people tend to fall asleep on a table. They're very, very relaxed. And I always say, how can it be uncomfortable if people are relaxed and are just happy to be there and come back just for peace and balance? So I say it can be extremely comfortable.
Sounds good to me. I can live with that.
Yeah, absolutely. Yeah. Absolutely. You know, I mean, these needles, if you saw them, they bend like a hair. They're that thin. You know, regular needles, I hate shots. I hate needles myself. But regular needles are hollow for injecting. They're much thicker, and they have no resemblance to an acupuncture needle. So if anybody's thinking, why would I go and get a million, like a shot or something like a transfusion or whatever, it's nothing like that. Unfortunately, it has that needle name, and that's scary for a lot of people, and I understand that.
Right, right. Well, I am completely enjoying this conversation. Let's take a short commercial break, and audience, we'll be back in a moment on Learn to Live Stress-Free Now with our featured guest, personal revolution coach and professional acupuncturist, Roberta Mittman.
Hi, I'm Dr. Robert Wright Jr., the Stress Relief Doctor, co-host of the Learn to Live Stress-Free podcast series. I'm an author, speaker, and stress management wellness coach. My published study is the first to show the connection between stress reduction, grief recovery, nitric oxide spiking, and the relaxation response. And my practical application of this knowledge helps you relieve the stresses of everyday life. I have the tools to dissolve your pain points quickly and effectively. Email me to find out how you can start to feel better now at stressfreenow.info/contact. That's stressfreenow.info/contact. Have you been procrastinating about completing an important project or pursuing a treasured dream? Christine Wright specializes in helping her coaching clients to lay out clear, elegant strategies. She shows you how to quickly build your confidence to uncover and eliminate your habitual patterns of resistance and self-sabotage. Christine helps you discover those meaningful insights that will get you to do what works so you can celebrate your successes. Go to stressfreenow.info/contact to let Christine know that you're ready to live your ideal life now. Again, that's stressfreenow.info/contact.
Welcome back to Learn to Live Stress-Free as we continue our conversation with our featured guest today, personal revolution coach and professional acupuncturist, Roberta Mittman.
Roberta, one of the things that pops into my mind, and I'm sure people out there listening, when you mention the term acupuncture, as you said, that for some people at least, there would be some type of fear associated with needles. You know, I think everybody's heard a story where, like, some big athletic guy, they draw blood and he faints. So I'm just using that as an example.
Yeah,
so the thing is, I know myself, I particularly don't care to get needles. When you mentioned the term needles, I was thinking of that big needle that, like, when you're at the dentist and they're going to put it in the roof of your mouth, and I'm like, oh my goodness, you know. And when you see that thing coming,
yeah.
well, yeah. Well, it just wait. No thanks. No thanks. No thanks. Because whenever I remember when I was a kid, and the first time I saw that needle. So thank you, first of all, for pointing out that although they look similar, that's about it. That it's not the same thing. As you mentioned, a regular needle is hollow. So let me ask you this: how do you, as a practitioner, address fear that a person may have? And I'm going to ask you that question on two levels. The first level is, you know, obviously when you have someone come into your office, just like, say, a dentist would say, and they're like, well, I'm afraid of the pain, right? So now but they're there already, and you have the opportunity to address that. So I'd like you to let us know how you address that situation. But now, let's say you're at a cocktail party and someone says, oh, Roberta's acupuncture, and they said, oh, I would love to try that, but I'm afraid. So I'm sure there are many people out there that would love to try acupuncture, just like reflexology or massage or Feldenkrais or Alexander, but the needle part of it, they would be thinking about the potential pain. So how would you address those two situations?
Well, you know, this is a great question, because this is what I have, been confronting, because these, I'm working with sharp objects, correct? So that's
yes.
Totally understandable. And as I said, I don't like needles either. So when somebody comes in, honestly, I just assume for the first time that that's how they're feeling, that they're really nervous. And that this is like, what did I get myself into? And like, usually it comes from a doctor's recommendation or from a friend or whatever, you know what I'm saying? So it's kind of like, okay, well, they told me that this is not going to hurt or whatever, but it's still a needle. I understand. So what I do is I show them exactly what it looks like, and they see how thin it really is and how flexible and it bends. And I explain to them a little bit about what we're doing, which is really all about balancing your kind of life force, your life energy, and finding certain points along the meridians, which I'm happy to chat about, that really accomplish that purpose. And for people that come in the first time, honestly, I might just do one or maybe two, and the rest acupressure, just to see how they feel about it. And I would say 99% of the time, when I say, so how are you doing? They said, oh, this is it? Keep going. This is fine. That's exactly what I hear. They said, this is nothing what I expected. And if I can tell you, I would have a tape recorder of how many times I hear that. So a lot of it is anticipation because they're thinking the word needle. I use the word filament because they're so thin, and they don't even look like needles, actually. So they have this little tube on them, which is because they're so thin, they need a little tube. I just have to show them, and then they go, oh, okay, and they tend to relax. And then when they feel it, they feel so much better. And, it just is like not even up for discussion anymore because it's just a moot point.
Great. So that is, you're able to put people at ease. Let me just, as we start to wind down here, I had heard many years ago, maybe 25 years ago, that acupuncture was a novel way to help people that have addiction issues. In fact, when I spoke to a couple of people, in fact, they were therapists who went to be trained on how to help people with addiction. I asked them the same question. So, how did it feel? And they all said the same thing. They fell asleep when they were doing it. So, which is they were putting points in the ear. So, could you just speak to that? Do you have experience helping people with addiction issues? You already said sometimes people fall asleep, but I can vouch for that I have therapist friends who told me in the trainings they went to that they actually fell asleep, and apparently it's supposed to eliminate the physical cravings from addiction.
My father actually learned this a long time ago, as I was saying. His specialty was smoking cessation, among other things. And he passed on his secrets to me because he was wildly successful with acupuncture, with smoking. And honestly, I enjoy doing it. I get amazing results. I don't just stick to the ears, which is the auricular therapy. I do other things, and I also add coaching involved because, you just have to have a plan on how let's say you're going to become a non-smoker. Like, what is your plan? You need a plan. You just can't wing it. But psychologically, but physically, it can be very strong and impactful. There's actually a protocol that they use in Lincoln Hospital here to get people off of crack. And it uses this addiction treatment in the ears that you're talking about. So that's true. And it can help with a lot of things. One of the things that people will say, so if it helps with smoking and it helps with addictions, can you help me lose weight? And that's kind of where I say, you know what, I can help you lose weight, and it's a different conversation because you don't have to smoke to live, but you have to eat to live. And there's so much psychological, there's also with smoking, of course, but there's so many habits, and there's so much like guidance in terms of nutrition and different variables that are involved in that. So I don't kind of group food addiction necessarily with substance addiction. I feel it's a slightly different approach, but yes, to answer your question, it can be very successful.
Now, Roberta, are there other health issues that are particularly helped by acupuncture? What does it work best for?
Yes. So actually, what I like to do is kind of have this little list of things because I could sit there and think about all my patients and what they're coming for. I mean, basically there's pain, there's digestion, there's fertility, there's headaches, there's a lot of other things, like so many things, stress. But I have this list of what the World Health Organization has recognized acupuncture as an effective treatment for. And it's just, do you want me to read these few things?
Sure, go ahead.
Is that okay? Okay, ear, nose, and throat disorders, respiratory disorders, gastrointestinal disorders, circulatory disorders, urogenital, gynecological, musculoskeletal, psycho-emotional, and neurological disorders, and other conditions, that one could, that's from the World Health Organization. But other things could be, like we said, drug addiction, cancer pain, eye pain, some hormonal hot flashes, insomnia, that's a big one, and digestive, as we said, airway obstructions. I do things seasonally for pollens. This is my busy time for allergies. I mean, honestly, the list goes on and on. I wouldn't say, I like to say that I'm a member of your healthcare team. We'll work with what you're presently doing. It's probably not a time to go off all of your allergy medications right now, but our goal is for you to feel better, for you to be your own best healer, and naturally, maybe we can get your body to take over some of those functions so you can take less medication. So I like to be part of that east-west kind of continuum.
That sounds like an excellent plan. Well, Roberta, we want to thank you so much for sharing your expertise with us today and letting us get a little glimpse of what you do and how you work. And I really want to thank you for being our guest today.
It's my pleasure, Christine. Thank you so much, and Bob, for inviting me. I've enjoyed this conversation so much because I love spreading the word about
Excellent.
functions.
Now, Roberta, where can people go to contact you or to learn more about what you do?
On my website, which is www.robertamittman.com. That's MITTMAN.com, and or also by email, support@robertamittman.com. And I'm also on Facebook and all of the social media places.
Okay, wonderful. Thank you so much. So, audience, you can check out Roberta on her website, robertamittman.com. That's ROBERTAMITTMAN, robertamittman.com. Email her at support@robertamittman.com, and also check her out on the various social media platforms, including Facebook.
Wonderful, Roberta. What final thoughts or key idea would you like our audience to take away from today's broadcast?
Well, I think what I would like to say, my mantra these days is let's just be curious and see what it's like. Let's keep an open mind to different modalities and options that are out there for everybody to try. So I would say to be curious.
Fabulous, Roberta. Thank you for being our featured guest today. And audience, I want to thank you for listening in whatever time zone you're in. Sometimes we are surprised at how far and wide our listenership is, and so we're not just heard in the United States, we're also heard in Japan and Germany and Australia and in South Africa and Ghana and in other places. So whenever time zone you're in, I know it's 16 hours ahead of Eastern Time in Sydney, but thank you so much, audience, for listening. And the best part about podcasting is that you can time shift and listen to this show or any of our shows at any time that you choose to do so. Of course, as always, we welcome your comments and suggestions, and if you'd like us to invite back someone who you've heard before and you enjoyed, like Roberta Mittman, or there's a topic you want us to discuss, please let us know, and you can contact us through our website with your feedback and suggestions. Remember, listeners, if you'd like to experience the same benefits our coaching clients get with us, including learning how you can get more results in your day and easy ways to dissolve your chronic pain, stress, and anxiety, then give us a call at 954-900-2179. Mention that you heard our Learn to Live Stress-Free podcast show, and you'll receive a free gift from us. Call today to schedule your free consultation. For Christine Wright, this is Dr. Robert Wright Jr. of StressFreeNow.info. Until next time, be safe and be well.